Prediabetes is a condition where blood sugar levels are higher than normal, but not high enough yet to be diagnosed as type 2 diabetes. Of those with prediabetes, more than 80% don't know they have it. Prediabetes puts you at increased risk of developing type 2 diabetes, heart disease, and stroke. Definitions are variable depending on whether ADA criteria or WHO criteria are used. ADA, American Diabetes Association, defines prediabetes as impaired fasting glucose levels of 100 to 125, whereas the WHO, World Health Organization, has higher threshold levels of 110 to 125. ADA also defines prediabetes as HbA1c levels of 5.7 to 6.4. Prevalence estimates vary greatly due to different diagnostic criteria used and the choice of test. The lower cutoff, defined by the American Diabetes Association, ADA, leads to much higher prevalence rates than those defined by the World Health Organization, WHO. Estimates range from 20% according to WHO criteria to 35% according to ADA criteria. Risk factors are overweight and obesity, age 45 years or older, family history of type 2 diabetes, low physical activity, less than 3 times a week, history of gestational diabetes, diabetes during pregnancy, polycystic ovary syndrome. Screening is recommended for all adults 45 years or older, regardless of risk factors, and in adults who have overweight or obesity, BMI greater than or equal to 25, with one or more risk factors, regardless of age. If the results are normal, it recommends repeat screening at a minimum of 3-year intervals. Around 5 to 10% of people with prediabetes become diabetic annually. According to the ADA, up to 70% of individuals with prediabetes will eventually develop diabetes. But early treatment as well as moderate lifestyle changes can return blood glucose levels to normal range, effectively preventing or delaying type 2 diabetes. The goals of diabetes prevention include a return to normal glucose levels and thus preventing or delaying the onset of diabetes. Prevention measurements are usually lifestyle modification, including dietary therapy, physical activity, and smoking cessation. Goals are to achieve and maintain 7% loss of initial body weight and increase moderate intensity physical activity. Recommended diets are such as DASH or Mediterranean style. Recommended exercise is 30 to 60 minutes of moderate intensity aerobic activity on most days of the week, at least 150 minutes of moderate intensity aerobic exercise per week. Drug therapy with metformin, glucophage, should be considered in those with prediabetes, especially for those with BMI greater than or equal to 35 kilograms per square meter, those aged less than 60 years, and women with prior gestational diabetes mellitus. Another drug option is semaglutide, Ozempic, in patients with overweight or obesity. Surgical treatment of obesity, bariatric surgery, may be considered. Did you like what you watched? Please subscribe.